PinPoint Health Show, welcome to it. You want to reach out anytime during the show or otherwise, you can contact Dr. Lou, 1-855-55-DRLOU, info@pinpointhealth.ca. A lot of stuff you're doing. I'm like addicted to your Instagram, and not your Facebook. I came off Facebook, but your Instagram is fantastic. There's great stuff going on there.
You're not on Instagram anymore?
No, I'm on Instagram, not on Facebook.
You're not. No one's on Facebook anymore.
It's so negative. It's awful. It's just not nice. It's not a positive message, Dr. Lou. It's not nice.
Okay.
What's going on, pal? What's the update?
Yeah, so I think let's spend the show going through a lot of things, a lot of the new highlights about PinPoint Health. One of them, I mean, you just started with an example there of our growing presence on social media. You can follow me at Dr. Lou Nally on Instagram, on Facebook, LinkedIn, whatnot. Also PinPoint Health on all of those platforms. Yep. So if you just type in PinPoint Health, the content is going to be different, obviously. The PinPoint Health content is very much focused around the clinics, the services, and all those things, which that's actually what I think we'll spend a lot of today going through, is the extent of services that we can offer, because there's a lot, and I think we need to set aside a full hour, in all honesty, to sort of highlight a little bit about each of them, but we'd probably need an hour for each service that we're now offering. And so, I mean, I think there's very big changes that have happened. One of the great things about doing this show, it's really given me a lot of exposure to look at what the necessity is, what's missing, and where can we fill the gaps. And that's been great to have that exposure to people listening, coming to see me, and being able to determine that. So, I mean, the first thing that's been consistent for the history of this show and for as long as I've been doing this is the assessment with me. Right? Free consultation. Give me a call, 1-855-55-Dr. Lou, DRLOU. We will have a conversation around whatever it is you want to have a conversation around. We specialize in musculoskeletal pain and injury, meaning your muscles, your bones, your nerves, all these types of things. Sometimes people call me with other things that aren't necessarily related to those things. I'm also happy to have those conversations. We may not be able to help you with those things, but we'll point you in the right direction. Typically, when it is something that we can help with, the next thing is the assessment with me. And this is important. I can't diagnose somebody over the phone. I actually have to see them. I have to have a visit with them. I have to go through a full detailed history, physical exam, review any testing that they have, order any testing that we maybe think they would need. And we've developed a great process where we also have a sports medicine physicians who work alongside me, who can help expedite a lot of these different things to get people in for the services that they need quicker when it comes to imaging or other specialized tests. Once we've come to the diagnosis, which is the important component here, is we need to figure out exactly what's going on. That's what a diagnosis is what's going on. The next part is most people, you interact with someone, it's like, okay, great. You've now told me what I have. Good.
Yep.
What do you do next?
Right.
That's the big thing, right? That's the treatment aspect of it. As I've always said, we are not a one-trick pony. We have all kinds of different services at your disposal to treat these things, because we realize, not just we realize it, but the evidence suggests that the best way to deal with pain and injury is in a multifaceted approach, which means that we shouldn't just have one device or one intervention that we say works for everything. No, we are here to identify what your issue is and then tailor the treatment to the best evidence-informed approach to what that diagnosis is. That's the right way to go about this. And that's really what we're focusing on. So we have, again, tons of different services at our disposal. We have, and we'll start listing a few of them. So we have the rehabilitation services, the stuff that most people are familiar with, the physiotherapy and the chiropractic, the massage therapy, osteopathy, these types of things. This is where you're actually dealing with some type of specialized professional who will treat you in different ways. Now, chiropractors are non-surgical, drug-free specialists of the spine. So that's typically who will deal with those types of spine issues. Physiotherapists are also drug-free, non-surgical practitioners that work a lot in extremities, also spine-based thing, post-operative issues that they're dealing with. Osteopathy is sort of a hybrid between massage therapy and chirophysio type of stuff. So it's a little bit of an in-between. And then obviously the massage therapy, which is mainly focused on the soft tissue. So, I mean, those standard rehab things, chiropractic, physiotherapy, massage therapy, and osteopathy are the bread and butter of what we started with. But we've gotten into so much more. And that's what I really want to spend the rest of the show talking about, is all of the other services that we can provide.
We'll take our first quick break, get right back into it. Stick around for this entire hour, because the clinics are expanding, and one day, chances are you, maybe a family member, maybe a pal, are going to need these services, and it's going to be the place to go. So make sure you stick around and hear the rest. 1-855-55-Dr. Lou, DRLOU, and info@pinpointhealth.ca. Lots more of the Pinpoint Health Show is on the way. Back in just a couple seconds here on Global News Radio. And back to the Pinpoint Health Show. Reaching out anytime when we're not on the air or otherwise is 1-855-55-Dr. Lou, DRLOU, pinpointhealth.ca. Check the website out. Lots of information there. And because it is, that time, you want to check out all the sources on social media as well, mainly Facebook and Instagram as well. Pinpoint Health. There's so much good stuff there. I've been watching these videos with Dr. Wade almost nonstop, and it's really cool stuff, man. It's one thing to talk about it. It's one thing to demonstrate it through text or pictures, but when you can sit down and go, holy crap, I get it. I got that video. Yeah. Now it makes total sense to me. Really cool stuff.
Yeah, and it's all very much rehab focused, right? So these are the things that you would be recommended, and I mean, the proper form for these things is very, very important. And that sort of takes us from where we left off the last segment, where we're going to spend this show talking about the services that we offer. And we spoke about the chiropractic, the physiotherapy, the massage therapy, and the osteopathy, sort of the manual rehab services that we have, which most people, I think, realize we have those services, and we'll talk about more of those things. But I think one important thing to really highlight here is a question I get asked a lot, is how do you know who the right person is? Like how do you know who's a good chiropractor versus a bad chiropractor, and who's a good physio versus a bad physio? What I would say, and this is going to come across very salesy and biased, but I mean it in a very genuine way. If you're looking for a chiropractor, a physiotherapist, a massage therapist, go to pinpointhealth.ca. We have multiple locations across the GTA. We continue to grow. If you're looking for that right person, the team that I've put together, I can guarantee you is the right team that you want to be working with. We have very high standards of practice that we're looking for when we hire these people. We have a certain paradigm and ideology that we try to follow, and everyone that's working with us is following within those same things. So if you've heard me and you feel like you trust me, and you want an extension of that, and you're looking for one of these types of rehab specialists like a chiropractor, physiotherapy, massage therapy, or osteopath, visit pinpointhealth.ca, go to the location nearest you, and book an appointment with somebody. It's as easy as that. Let them know that you listen to the show. I can promise you'll be in good hands. And the other great thing about this is any concerns that you have, it's very simple how to get a hold of me. This isn't some like ownership or upper management where it's like, well, how do you even contact this person? No, it's simple. 1-855-55-Dr. Lou, DRLOU. You leave a message for me. If you or if I answer, you can tell me about any issue that you've been having. So I think that's important. So anybody looking for those types of services, sorry, I got a sore throat. Anybody looking for those types of services, that's the place to go. Now, within those specialties, so there's also specialized treatments that happen within those things. So people have heard of things like shockwave therapy, laser therapy, concussion management, concussion protocols. Those are things that these types of professionals would be working with. So if laser therapy is something you're thinking about for your particular issue. Now, again, I'm someone that believes that, we're not a clinic that laser therapy is the cure to everything or shockwave is the cure to everything. But it might be something that helps you with your particular issue, and we can help identify that. And if we identify that one of these, I'll call them specialized modalities, like laser therapy, like shockwave therapy, like concussion management, are things that you may potentially need, we're going to include it in your treatment, and we have that at our disposal. Traction tables, all these different types of specialized modalities that you hear about all the time. the nice thing to know is that we don't deal with just one of these things. We have all of them. And because we have all of them, we can tailor it to whatever is best suited for you, the individual. So if your doctor or someone has told you that, something like laser therapy or shockwave therapy or a specific concussion protocol would be best for what you're going through, again, I think it's worthwhile for you to reach out to us at PinPoint Health, and you can visit us at pinpointhealth.ca in order to find out more about those things.
It's interesting, though, that the way since we started doing the show years ago, how it's kind of transformed, and your offerings, it's so succinct and you've kind of widened it out. Is that kind of a reflection of you've seen a lot of bad things in the industry? A lot of one-trick pony guys have snake oil. And then there's the fact that maybe people don't have access to this stuff. That's more of a political thing, I guess, as far as being readily available, right? But I think that's part of the reason why you've expanded like this, right?
Yeah, and so when we first started out, this was mainly come get my assessment and we'll point you in the right direction. Right. That's sort of what this all was. The issue with that is you're pointing people in a direction, and I'm not able to control what happens after that when I'm sending them somewhere else. That's why we had a big interest in expanding and actually opening up clinics under PinPoint Health in order to standardize the things that I'm saying here. Because again, you're right. There's multiple things that you said there that are very correct, where there's clinics out there that are one-trick pony. There's clinics out there that are actually doing very negative things and fraudulent things, and they're not really about providing good care, but they're more about just making money. There's a lot of brands out there that aren't even controlled by a healthcare professional.
Wow. Where
the ownership isn't even healthcare, right? And I'm standing behind the clinic. I am the ownership, right? So you can be there's a part of me, I think, in the law, when it comes to healthcare, there's the saying that buy or have faith, like that when you're dealing with a healthcare professional or the healthcare industry, you should have faith that we have the best interest. That is exactly what we stand behind. And that's why I make it transparent that I am the owner of PinPoint Health, for this very reason, so that people know, excuse me, that this is something that they can stand behind. There's accountability. There's the show. People know how to reach me. All of the things that I've said for the last 3 years or however long it's been that we've been doing this. But you're right, we've expanded in all these areas because these are the things that I was recommending to people, and instead of sending them somewhere else, we can now send them within our own corporate structure and make sure that people get what it is they need.
Lots more to come here. Stick around. You want to reach out, get more information anytime on your own time, 1-855-55. Dr. Lou, DRLOU, info at pinpointhealth.ca. It's a PinPoint Health Show right here, Global News Radio. This is the PinPoint Health Show. Dr. Lou is here, and we're talking, we're going deep into what you provide as far as the clinics and as far as the network is concerned, because some people, even after 3-4 years, whatever it's been, listening to this show every weekend, they might not know. To reach out, by the way, it's 1-855-55 Dr. Lou, DRLOU, info at pinpointhealth.ca.
Well, not only on the show, we even have people within our clinics that don't realize the extent of all of our services sometimes because of how many there are. And right now we've gone through the chiro, the physio, the massage, the osteopathy, and then we talked about specialized modalities like laser therapy, shockwave therapy, specific concussion protocols that are things that are offered at the clinic. We also have integrative medicine approaches, so things like traditional Chinese medicine, naturopathy, and acupuncture, right? Which is big. This is a huge industry, right? And again, the nice thing about PinPoint Health is and think about what I just said there. I didn't say alternative.
Right.
Integrative. That's very, very important. We are looking to use all of these tools at our disposal.
It's refreshing.
We are not looking to replace something else, because we realize that there is a benefit to everything, even these more non-traditional forms of healing, like acupuncture, like Chinese medicine, like naturopathy, which are not the mainstream
Western style
medicine. But it is with us, because we also, along with those things, we also have specialized physicians with us.
Right.
People like orthopedic surgeons who are performing injections and surgeries when required. We also have physiatrists, which are pain specialists who are using pain medications and injections when necessary to deal with these things. And we're dealing with it in an approach where we put all of these things together. So we're not saying that our naturopathic doctors or our acupuncture providers or our TCM practitioners, the traditional Chinese medicine, are alternatives to these things. No, they're integrative. They are part of this. And there's many people that are doing the Western approach where they are, already getting an injection, but they're also including this because it's so very well supported in the research that when you can put all of these things together, it helps so much. And so those are the integrative medicine approaches that we have. We also have lifestyle things like personal trainers that you could deal with, dietitians and nutritionists that can help you figure out how, different compositions of food can help different things, how we can change being active, the personal training side of things, all of the rehab aspects, right? So, and I keep going to recap. And again, this is one of those shows that's maybe sounding a little salesy. Again, my intention is not to be an infomercial here. My intention is just to really get across to our listeners and the people who listen to this show week in and week out the extent of our services. This isn't just Dr. Lou anymore. This isn't just me. This is me and a whole massive team of professionals behind me that provide these things. So we went through chiropractic, physiotherapy, massage therapy, osteopathy, specialized modalities like laser therapy, shockwave therapy, concussion protocols, more integrative approaches like naturopathic medicine, traditional Chinese medicine, and acupuncture. We also mentioned a little bit about the Western approach to things, the more traditional approach that we're specialized physicians, orthopedic surgeons, physiatrists, sports physicians who work with us dealing with this in the most conventional evidence-based method. And some of the things on that side are things like the PRP injection, right? Which is done by our physicians, the platelet-rich plasma injection. Sorry, I had to think about that for a second.
I know.
Which, we started doing these just in the knee. And I always said we try to be evidence-informed, right? Which means that as there's more evidence to support that these injections may help for other types of injuries, we'll start to include them. So we have started to do some PRP injections for shoulders and hips as well, as the research is getting better and better, and people are doing well with it. So PRP injections, if that's something you're considering, you should 100% give us a call. Like the team that we have doing these things is incredible. We can get you in very quickly for these types of services. And it's some of the best stuff out there. We're living in an environment where I think most people, and this is a good question for you, John, most people want to avoid medications.
Yep.
Right? Like that, and that's
unless they're incredibly lazy and don't care that much about their own health. They want to, because it is more work, but I understand what you're saying. Avoid medications as long as you can.
Yeah, and I'm not necessarily saying that in all cases, but what I am saying is I think there's a perception in the public. I've seen it. The people that I work with have seen it, that 20 years ago when you told somebody, here, take this pill, they took that pill. Yep. There wasn't much questioning it. Now when you tell someone to take a pill, the first thing they're saying is there's something else that I could be doing. Yeah. Because and now that's sort of like, we're also moving the other way, which I think is dangerous. Like medication plays a role, and our physicians also prescribe medications. But if you are looking for other alternatives, and in the injection world, when you're dealing with pain, there's a lot of things that are medical-based injections. The great thing about PRP is it's your own blood, right? And there's tremendous benefits to it. That's the other thing. It's not like this is just something that, sounds great, but it actually works, especially for things like osteoarthritis of the knee. So if you're that person who's supposed to be going in for a knee replacement, but you want to delay it for a few more years and are looking for a way to control the pain, PRP injections. There's also some research that's emerging on how the blood, those platelets that you extract with the hormones that are in it, can actually help with the repair of tissue. So things for like supraspinatus, like shoulder issues, shoulder strains, how it can actually help to increase the strength of tendons and ligaments. So again, PRP injections, another service that we're offering. If it's something that you're considering, someone's told you it might be of benefit for you, you're wondering, give us a call. I'm happy to have the conversation to see if it's something that is right for you. And the other thing that I've said multiple times is, out of 100 people that I get asking about PRP, once I've actually gone through the proper assessment with them, we're probably carrying it out with 20 or 30% because, again, it's one of those things that everyone thinks, oh, I should do it because it's the right answer for me. But we're figuring out that there might be better answers. So we're not, again, a one-trick pony where this is the only thing that we're looking to do. This is just part of the whole overall process. And if we do determine that it's something of benefit that would help you, we'll make that recommendation.
And the part I really like about the PRP injection is the actual physical injection. And when you get to that point, I mean, between Dr. Bragava and Dr. Gordon, these are very, very high-level surgeons that have the
and we actually have
a
few more people doing this as well. We won't go into the names or whatnot, but yeah, again, that's not just a reflection of those surgeons,
right?
But we could talk about anything. You pick a physiotherapist. We're making sure that we have the best of the best at PinPoint Health.
Lots to go here. Stick around. Reaching out, simple, 1-855-55-Dr. Lou. That's DRLOU, info@pinpointhealth.ca. Couldn't be simpler. Lots more. The PinPoint Health Show is on the way. This is Global News Radio. The PinPoint Health Show, we are at it, and we're going strong here. Lots still to talk about as we get about halfway through the show here. You want to reach out, 1-855-55-Dr. Lou, DRLOU, and info@pinpointhealth.ca. PinPoint Health on social as well. You want to check out some of the wonderful stuff you guys are doing on both Instagram and Facebook. And, watch the videos, learn more for sure beyond what you get on the show every week for an hour.
Follow PinPoint Health on any social media platform. And just, an extension of the show, the visual component. So we've gone through a lot already. Another big thing that I want to bring up is medical cannabis.
Okay.
Also something that we've now introduced. We have physicians who are now prescribing that when necessary and when it's an option. Now, the reason why I bring this up almost in its own segment is because a lot of people, now that we live in an environment where it's legalized, one of the arguments that I've heard is, well, I don't need to get a prescription for it. I could just go get it and smoke it. That's a dangerous thing. It's not a dangerous thing. I mean, forgetting the addiction component and all those things.
Right.
If you are trying to self-medicate with marijuana, you don't know what you're doing, okay? Let me put it to you this way. Even the people in this industry that work in it every single day, they almost can't even say that they fully know what they're doing with the medical side of things. So, as an example, one of the arguments that you hear a lot about is comparing, let's say comparing marijuana to alcohol, right? And people will say, oh, but alcohol makes me feel so much worse and blah, blah, blah. And the only reason why I bring this up is to bring up one very specific thing. Alcohol is one chemical. It's alcohol. Mm-hmm. That's it.
Right.
Cannabis is over 400 different chemicals and compounds, of which we don't understand even all of them. Most people know the distinguishing between the THC and the CBD, and the CBD having more of the medicinal effects. Great, but there are specific properties within each of those that do different things. That is where the medical cannabis comes into play. So if you are actually, this is for the people, this is not for people who just want cannabis. Because it's legal, you can go get it. But if you're thinking, is this something that can help you with your issue? You have chronic pain, you have insomnia, whatever medical issue you have, and you're wondering, is cannabis something that could help me? Do not self-medicate. Do not be your own doctor and go buy recreational marijuana, cannabis, even from the proper channels, right? We're not talking about black market. Don't try to self-medicate thinking, well, I'm just going to get something that's CBD and not THC.
Give it a shot. Yeah.
Because I can promise you're not going to do the right thing. It's not going to be the right combination of things. That's why there's a whole industry of professionals that exist on the medicinal side of things. And where it does play a role, there is great benefit. And if you're wondering what the appropriate compounding of those chemicals is for you, you would do yourself justice to give us a call and come see one of our physicians specializing in medical marijuana. Okay? This is for anybody who's genuinely interested for the true benefits of it from a medicinal standpoint. Right. Self-medicating with this, I was at a conference a couple weeks ago where the whole day was pretty much around medical marijuana, and the things that I learned is incredible. Like, we don't even understand it fully as a medical community. So someone in their basement trying to self-medicate, It's just, I can promise you, you're not actually helping yourself. Now, there are true medicinal properties and true medicinal things that can help with it. There is a place for it, but you need to get it done the right way by the right channels. And the only channels to get that medicinal effect are through the medicinal channels, and you have to see a physician for those things. And we now have physicians that can help prescribe medical marijuana and medical cannabis if needed.
It's really wild because it's gone from this whole, Cheech and Chong thing in the basement, guys smoking up, to it's the science is, as you mentioned, you need to know your science, but it's expanding all the time.
Huge and emerging.
Yeah.
And my point is, get it from the right channels if you need it from a medicinal perspective. Yeah. If you're considering medical marijuana, medical cannabis because of some benefit to your health, you may be right, but do it through the right channels. Don't self-medicate. Don't self-diagnose. Come see one of our physicians and get the proper prescription required for your issue.
1-855-55-Dr. DRLOU, info@pinpointhealth.ca. We've covered a lot. We'll cover a lot more. Still more time to go here. It's the Pinpoint Health Show on Global News Radio. And back with more of the Pinpoint Health Show. You'll want to reach out, get a hold of Dr. Lou. Real simple. Remember this number, 1-855-55-Dr. Lou, DRLOU, and info@pinpointhealth.ca. That goes for social media as well. Pinpoint Health.
You know what's crazy, John? The show's running out, and we have still so many services to go through. So,
who's next hour? We're gonna
we're gonna pick it up a little bit more. On top of the things we've already talked about, then we also have products, things like if you need custom bracing or any type of bracing,
orthotic type of stuff,
orthotic devices, cool. Compression stockings, all of these things that we can help you with. The other great thing, and the behind the scenes administrative stuff that I'll throw in before I forget it, because this is important. People will often ask, are your services covered by OHIP?
Right.
You can imagine in the things in the amount. It's a very difficult question to say yes or no to. It depends on which service you're talking about.
Yep.
So I think most of us know that, for example, bracing is not covered by OHIP, but it is covered through most extended healthcare plans. So the great thing about our administration is the things that are covered by OHIP will be covered by OHIP. You'll be told about that. The things that have extended coverage for it, not only will you be told about that, but they will do their very best to make your interaction as hassle-free as possible. What that means is if things can be billed directly to the insurer, whatever is the easiest way to do it, which is always stipulated by the insurer. This isn't stipulated by us. We just follow the rules of whatever the insurance company is and whatever that specific policy is. But most insurers now allow direct billing for all of these things. So we do provide all of those hassle-free services. We also deal with other third-party things like MVAs, car accidents, car insurers, and WSIB. So if you've been hurt at work and you have a WSIB claim and they're paying for your treatments, we can deal with that. Car accidents, and we can and they will pay for those types of things. And then creams, pillows, all of those types of services. So there's a lot there that we can do. In terms of those things. The other thing that I really wanted to talk about in terms of services, and I've brought this up before, is let's go to the MVA world, the car accident world, a little bit. One of the components of being hurt in a car accident is, unfortunately, there's a legal component to that. I've always found it very interesting that when you think about, like, most of the commercials and ads out there about being hurt in a car are not about, hey, make sure if you're okay. It's no, get the right lawyer.
Yeah.
Right?
Yeah.
Like that is the first thing. And it's become bigger here in Canada, but that's a huge thing in the States where it's like personal injury is massive. Now, legal representation is very important. I'm not suggesting that people shouldn't do it, but what's also very important is your overall health. Mm-hmm. So if you've been hurt in a car accident, like I'm sort of going to try to break the model here. Don't worry about calling the lawyer first. Call Pinpoint Health. Yeah. Because the other thing is we can help you find a lawyer. We work with a lot of great firms, a lot of great people that we can put you in contact with that will get you what you actually need. Because the other reality of that industry, like a lot of industries, is there's good and bad. And you, without doing much of your own research, may also call the wrong type of firm.
Of course you will.
We've dealt with a lot of firms, and we can potentially set you up with the right type of firm. And I think that's an important thing. Like, we're there for your health. But again, we fully understand that when you need legal representation in these things. The other thing we do, and I brought this up before, is providing independent assessments. So specifically, if you've been hurt in a car accident and your lawyer needs you to get an independent assessment because you're going up against the insurer, give us a call. We have a whole roster of physicians that do this particular type of work. And we make sure that we choose the very best of these types of physicians to do this. So, if you're listening to the show, you have a say with what happens with your legal representation. Ask your lawyer. Tell them you want to have a conference call with me. You want to talk about the types of assessments that we can offer, how we can help build a case for you. We're happy to provide that service as well. That's another great service that we have. So the car accident stuff, if you have any questions around, if you've been in a car accident and you have any questions, give me a call. I'm happy to talk to you about it. Make sure that you're getting, even if you're going somewhere else, I'm happy to make sure you're getting the right type of care, that you have the right type of legal representation. I know a lot of people, I was speaking to someone not long ago who was actually not happy with their lawyer. And I suggested, well, why not change? Like, if you're not happy. And the stuff that they told me about the scare tactics that lawyer had told them is crazy.
Yep.
And it's also BS, like stuff that'll never hold up, because you do have a choice. You do have a choice who represents you. Excuse me. And again, if you're looking for an opinion, and I'm not telling you have to go to the people that I recommend, but if you're looking for an impartial opinion and you're looking at it from someone who deals with it from the healthcare side of things, I'm happy to give that opinion.
And again, you say it's impartial because people might be thinking, well, you obviously have some interest. Well, you don't, because you're here doing a radio show. You're exposed. You have skin in the game. You cannot risk it. Why would you?
I've never ever created any model with any lawyer, like in terms of a kickback or something like that. We get nothing out of it. The only thing that we will do is we will help fulfill those independent assessments.
Right.
So typically a lot of the lawyers we work with will contact our roster of physicians, but that happens because we have a great roster of physicians, right? So, but we are not, like, this isn't one of those things where there's a lot of stuff that happens in this world, and
you rub my back, I'll rub yours type of thing.
Yeah, this is not like, hey, if I send you a file, X amount of dollars comes back to me. I'm putting that publicly on the air. I don't get any kickback from any lawyer that I refer to. I am simply doing it because I believe in that particular lawyer, and I believe that they will provide great representation. Right. And that lawyer will often use me and my team for the assessment base because they believe in our assessments. Simple.
We got lots more to go here, so stick around. We'll take a short break, make it as short as possible, and get right back into it. You want to reach out, contact 1-855-55 Lou. That's DRLOU, and info at pinpointhealth.ca. It's the Pinpoint Health Show on Global News Radio. Pinpoint Health Show, we're right back at it here. Reaching out is simple. Keep this number on. You write it down or put it on your phone, 1-855-55 Lou, DRLOU, real simple. And by the way, it's info at pinpointhealth.ca to reach out through email. And simply go to Pinpoint Health, and on social as well, Instagram, Facebook. There's all kinds of learning to be done. And you can literally spend hours there watching videos and learning stuff. It's really beneficial.
This show seems like a massive infomercial this time, eh?
It's not, though, man. It's information.
It's information.
You're not selling a product.
I hate that idea. Like, I really try to do this, like, obviously, is there a return of the investment? Of course, people come see me. They spend money. They're like, I am in business, but I do run this mainly as a public health promotion. Like, I'm really trying to get good advice across. And the reason why I'm doing this and the reason why I'm building Pinpoint Health, is because I want people to get the right care. And that's why we've gone through all of these services over the show. And there's even more. And one thing that's important, another thing, is on the psychosocial side of things, right? Where if you need a psychologist, if you need a social worker to help you, not only that, but we've also created a specialized program, a Pinpoint Health educational session with a social worker, 3 sessions done via in person, over the phone. It's not counseling. It's 3 sessions where you work with someone to understand the tools and the right things that you can do to start changing that psychosocial aspect that plays into pain. Which again, we've done tons of shows on that and how important that is. But I mean, so the extent of services, like, it's huge now. Like, I look at it sometimes, I'm like, wow, I can't even believe it. Like, just as an example of how specialized we are, up in Newmarket, particularly at our Newmarket clinic, we have a physiatrist there that all she does is deal with amputees.
That's it.
That's how specialized that there's one particular physician just dealing with amputees, right? So we are really like, now that's not available at all of our locations, but again, my point being is that we are really working on the full spectrum of pain and injury management, right? Obviously, the vast majority of things are sprains, strains, those things. That's why the chiro, physio, massage is so much bigger because, and we have that everywhere because those things happen much more often, thankfully, than things like amputations. But in those cases, we also have that in our network where we can get you to the right people. There's a chance that we may also start doing PRP injections for spine-related stuff, which there's emerging research on that. So just, again, there's so many things that we offer. And I mean, if just to reiterate, you can go on the Global News site and listen to this show again, or just visit pinpointhealth.ca. But the simplest thing is it all starts the same way. You just give me a call and we have an assessment.
Yeah.
And the great thing is, again, it's not like I'm always going to recommend X treatment because that's all we do, right? No, you just heard it. We spent a whole show, which we probably need a few more shows to go in depth on each thing. But again, I really wanted to spend this show just to really highlight the extent of services. We can tailor the treatment plan. Every person gets a different treatment plan because think about how many services we went through and how many combinations. There's thousands of combinations.
There's no cookie cutter. It can't be.
There is no cookie cutter approach to this. And that's very, very important because we want everyone's treatment to feel not only for it to be individualized, but for them to feel like it's individualized to them because that's the best form of care. That's what the research supports, that it has to be tailored to the individual needs and what the specific diagnosis is, what the specific prognosis is. And when we do that, we achieve good results. And that's why PinPoint Health is achieving the results that we're achieving with our patients. And I mean, again, go online, go on Google reviews, all those things. That'll speak for itself. You'll hear what people have to say. Do we have negative Google reviews? Of course we have negative Google reviews.
You want them.
But look at what they are. Like, as an example, one of our Google reviews is that person came in to see one of our orthopedic surgeons, was referred for an x-ray.
Okay.
They had to wait for 2 hours at the x-ray lab. Mm-hmm. We got a 1-star because of that.
Nice.
We don't control the
Nothing
x-ray
to do
lab.
with you.
We don't control that. If there's a long wait list for the x-ray, our job is to the surgeon recommended the x-ray, then reviewed it and made the proper recommendations. But if you're concerned with the length of time that you waited at the lab, then contact the lab.
Right.
Regardless of that, I'm happy to hear those things because then we just contacted the lab and we said, listen, when we send patients over, we'd like to know, what are we telling them? Because we could be more transparent with our communication. Maybe it's on us to say, listen, we're going to refer you to this radiology lab, but
bring a sandwich.
Yeah, you might be waiting an hour today, right? So it is good feedback, but I think people also have to, you want to read those negative ones because you'll see that they're not really negative. Another person with massage therapy was sore the next day after massage therapy.
Good.
1 out of 5.
Wow.
That's what will happen after massage, right? That's what happens. You're breaking down tissue.
I heard after I worked out. Good.
Yeah. And I mean, again, the extent of services. One other thing I forgot to mention, in our Brampton location, there's a walk-in clinic there with family practice.
That's a big location.
That's
right?
a big location.
Yeah.
Mississauga Road and Financial Drive, which is just north of Steeles. But if you're looking for if you live in that area and you need literally a one-stop shop for your health, you've got everything. Family practice, walk-in doctors, rehab, med spa, pharmacy, lab.
Awesome.
There's even a fitness center.
Come on.
Yes. Like everything.
That's crazy.
Yeah. That's what PinPoint Health offers. That's what we're becoming, and we're growing. You know,
it's funny you left to the last segment, but I think you can't overstate the importance of bringing in the psychosocial part of it too, because that is huge. The research on that in the last 10 years has been massive. It is just as important as the physical. Going back to that program, the three session educational session, 3-session educational program, not 3-session educational session that we created. We did that specifically because there's still a stigma around getting counseling for your mental health issues, right? And really what this is designed for is to give people a knowledge around the different things that they could be doing. And the other thing is exposure. Once they could see how much science is behind it, they'll start to realize, like, you know what, it probably is important. Like, if you clean your teeth every day and go get them checked out every 6 months, what's wrong with making sure your mind's working the right way every 6 months? Like, there should be no more stigma around counseling for mental health issues.
like, we're worried about our teeth, but we're not worried about our minds.
Your noodle, yeah.
Yeah, like that to me is crazy that we still have a stigma around that. So this 3-session educational program with PinPoint Health, it's a great opportunity if you have these things and you're wondering, get exposed to it, get a little bit of knowledge. It will empower you to do the right things later. It's really about giving you empowerment, and then the rest usually happens on its own.
You've talked a little bit before we wrap up about the expansion. You were one clinic at one time.
Yeah,
I remember.
We were one clinic
right?
at one time. Yeah,
and now where are you?
We are at 6, I believe, and we probably will have a 7 and 8th within the next year that we're working on right now. So, again, it's hard for me to say. Visit PinPoint Health and just see where we're at. PinPointHealth.ca. Check out the locations, the one closest to you. Some of our more specialized services are not available everywhere. Mm-hmm. Like, we are not doing PRP injections everywhere.
Right.
But again, it's not that if you have to travel to Etobicoke to get that done one time, I don't think that's a big deal. But we are going to be trying to expand all of our services into every location.
Nice.
And most of them do have most of the services, but there might be some specialized things. Like I said, like the example of the amputee clinic up in Newmarket is only in Newmarket. But, again, any issue, anything, pain, injury, visit pinpointhealth.ca, check out all of the services. There's so many different things, so many different tools that we can use to help you get better. But it all starts with giving me a call. And I'm the lead person on this. I'm the one seeing you and pointing you in the right direction. And I think people want that. People hear and they say, I want to see Dr. Lou. You will. You will see me. I will make sure that you are pointed in the right direction. I will direct the care and make sure that you get what you're entitled to and what you need to get better.
It's good stuff, and it's a lot of stuff. We're done for today. Go rest your voice, man. Big time. We'll catch you again next weekend. Reaching out, by the way, one more time, 1-855-55 Lou, DRLOU, pinpointhealth.ca, and info@pinpointhealth.ca for email, and PinPoint Health on social as well. We'll catch you again right here on PinPoint Health Show on Global News Radio.